If I told you that the medication sitting in your medicine cabinet right now, the one your doctor prescribed to keep you healthy, could actually be sabotaging your sex life, you believe me. Most men don't realize that some of the most common prescriptions out there might be lowering their libido, killing their erections, and doing it so gradually that you might never even connect the dots. I'm Dr. Reena Malik, a urologist and pelvic surgeon. And today we're talking about something that affects millions of men, but nobody's really discussing how your medications might be destroying your sexual function. The shocking part, number 3 on our list is something over 100 million Americans take every single day. But before we get into that, we need to understand how erections actually work. Here's what most men don't realize: erections aren't just about what's happening down there. They're a full body process. Think of it like an orchestra. Every instrument has to be in tune or the whole performance falls apart. When you're aroused, your brain sends signals down your spinal cord to the nerves in your penis. Those nerves then release a chemical called nitric oxide. Oxide is like the master key. It tells your blood vessels to relax and expand. As the vessels widen, blood rushes into the erectile tissue, fills it, gets trapped there. That's what creates and maintains an erection. But here's the problem. If any single part of that chain breaks, the whole system fails. You need healthy blood vessels, healthy nerves, balanced hormones, and a responsive brain. Remove any one of those and you're in trouble. Medications can sabotage this process in 3 main ways. First, some reduce blood flow to the penis. Imagine trying to fill a balloon through a kinked hose. The water's there, but nothing's getting through. Second, other medications affect the nervous system, dulling the signals between your brain and your penis. And third, medications alter your hormone levels, especially testosterone, which is crucial for desire and performance. The research is pretty clear on this. A large study using data from the Erections database looked at over 3,000 men taking prescription medications. Those men were 80% more likely to experience erectile dysfunction compared to men taking nothing. And here's what's important: even after adjusting for age, education, BMI, diabetes, high blood pressure, and smoking, the link remains strong. This isn't just coincidence. These drugs may directly contribute to ED. Let's start with number 5. Beta blockers like atenolol or metoprolol. Doctors prescribe these for high blood pressure, heart disease, and sometimes anxiety. They work by slowing your heart rate and lowering blood pressure, which is great for your heart, but it can reduce blood flow to the penis. Many men notice their libido drops or their erections become weaker after starting beta blockers. Not everyone experiences this, and newer beta blockers like Nibivolol seem to have less of an effect. But if you're noticing changes, talk to your doctor. There may be alternatives that work better for you. Antidepressants, particularly SSRIs like sertraline, fluoxetine, and paroxetine. These medications are genuinely life-changing for people struggling with depression and anxiety, but they're also well known to interfere with sexual function. They can reduce desire, delay orgasm, and make it harder to get or maintain an erection. Here's why. Serotonin, the chemical these drugs boost, tends to suppress dopamine and testosterone, both essential for sexual excitement. If this is happening to you, don't just accept it. To your healthcare provider. Sometimes switching to another antidepressant like bupropion or adjusting your dosage minimize these effects without sacrificing your mental health. Now, number 3 might surprise you. It's statins. Medications like atorvastatin or simvastatin that lower cholesterol. Over 100 million Americans take them every single day. These drugs reduce cholesterol production in the liver, which lowers your risk of heart attack and stroke. But here's the thing. Cholesterol is also the building block of testosterone. If your levels drop too low, it can lead to lower testosterone, reduced libido, and weaker erections. The research on statins and ED is actually mixed. In some men, improving cardiovascular health actually improves erectile function. But in others, hormonal drop becomes really noticeable. It's about finding the right balance with your doctor. Number 2, antihistamines like diphenhydramine, loratadine, or cetirizine. These are the allergy medications many people take daily or seasonally. Antihistamines block histamine, a chemical involved in allergy symptoms. But here's what people don't know. Histamine also plays a critical role in arousal and orgasm. Too little of it, and you can experience decreased sensitivity, delayed orgasm, or reduced erectile response. Term use usually isn't a big deal, but if you're taking them daily for months, it could start to have a real impact. And finally, the most overlooked category, acid reflux medications, especially proton pump inhibitors like omeprazole, lansoprazole, and pantoprazole. These are among the most commonly used drugs worldwide, and many men take them long-term for heartburn or GERD. But chronic use can reduce magnesium and vitamin B12 levels, absolutely critical for nerve health and hormone balance. Over time, this can contribute to reduced testosterone and nerve dysfunction, which directly affects your erection quality. So what should you do if you're on one of these medications and noticing sexual side effects? The answer isn't to stop them suddenly. Many are essential for your health. Instead, have an open, honest conversation with your doctor. Ask if there are alternative drugs with fewer side effects, or if lifestyle changes like diet, exercise, weight management, smoking can help you reduce your dose safely. Sometimes just switching from one type of drug to another can make a huge difference. Also, power of lifestyle. Regular exercise, good sleep, and a balanced diet rich in antioxidants and healthy fats all support blood flow, hormone balance, and nerve health. 3 key ingredients for good erections. Limiting alcohol, managing stress, and keeping your blood sugar in check are incredibly important too. Bottom line is this medications save lives, but they can have hidden costs. If you're struggling with erectile dysfunction and can't find an obvious cause, look at your prescription list and talk to your doctor. There are solutions. You don't have to choose between your heart health and your sex life. You can have both. Thank you. Medications directly interfere with erections through 3 distinct mechanisms that disrupt the complex biological process required for sexual function. Understanding how this happens is crucial because erections aren't simply a localized event. They require coordination between your brain, nervous system, blood vessels, hormones all working together in perfect harmony. The first mechanism involves reduced blood flow to the penis. When you're aroused, your brain sends signals that cause blood vessels to relax and expand, allowing blood to rush into the erectile tissue. However, certain medications like beta blockers constrict these blood vessels or reduce overall blood circulation. Imagine trying to fill a balloon through a kinked hose. The mechanism is there, but the pathway is blocked without adequate blood flow. The erectile tissue cannot fill properly, making it difficult or impossible to achieve or maintain an erection, even when you're mentally and emotionally aroused. The second mechanism affects your nervous system by dulling the signals traveling between your brain and penis. Medications like SSRIs and certain antidepressants interfere with neurotransmitter activity. These drugs suppress dopamine and testosterone activity while boosting serotonin, disrupting the delicate chemical balance needed for sexual excitement and response. When these nerve signals are weakened or delayed, penis doesn't respond properly to arousal, resulting in decreased sensitivity, difficulty achieving erections, or delayed orgasm. Essentially like turning down the volume on the communication system that triggers sexual response. The third mechanism involves hormone level changes, particularly affecting testosterone production. Medications like statins lower cholesterol, which is the fundamental building block for testosterone synthesis. Pump inhibitors reduce magnesium and vitamin B12 absorption, which are essential for hormone balance and nerve function. When testosterone levels drop, libido decreases significantly, and even if the physical mechanisms for erection are intact, the desire and motivation to engage sexually diminishes. This hormonal disruption can also impair nerve function over time, compounding the problem. Research from the NHANES database examined over 3,000 men taking prescription medications and found they were 80% more likely to experience erectile dysfunction compared to men not taking medications. Makes this finding particularly significant is that researchers used statistical methods to adjust for confounding factors like age, education, BMI, diabetes, high blood pressure, and smoking status. Even with these adjustments, the link between medications and erectile dysfunction remains strong and statistically significant. This suggests the medications themselves are directly causing the problem, not just coinciding with other health issues that naturally cause ED. This evidence demonstrates that the sexual side effects aren't minor or rare. They're a real consequence affecting millions of men worldwide who are simply trying to manage their health conditions. Don't stop medications on your own. Work with your doctor to find solutions that allow you to maintain both your physical health and sexual function. This is perhaps the most critical message because many men, upon realizing their medication is causing erectile dysfunction, make the dangerous decision to simply stop taking their prescribed drugs. This approach creates a false choice between treating a serious health condition and having a satisfying sex life, when in reality, better options often exist. Many of the medications on this list are genuinely life-saving. Beta blockers prevent heart attacks and strokes. SSRIs and other antidepressants treat depression and anxiety disorders that left untreated can be debilitating or even fatal. Statins reduce cardiovascular risk in millions of people. Acid reflux medications prevent serious complications from GERD. Stopping these medications without medical supervision can be dangerous and potentially life-threatening. Suddenly discontinuing heart medications, for example, trigger cardiac events. This is why any changes to your medication regimen must happen under professional medical guidance. Instead, the solution is to have an open and honest conversation with your doctor. Many physicians are not aware that their patients are experiencing sexual side effects because patients often feel embarrassed discussing this topic. Creating that dialogue is essential. Tell your doctor specifically what you're experiencing, whether it's difficulty achieving erections, reduced libido, delayed orgasm, and when these symptoms started in relation to beginning your medication. Your doctor has several options to address this problem. First, there may be alternative medications within the same drug class that have fewer sexual side effects. For instance, newer beta blockers like Nibivil cause less erectile dysfunction than older versions like Atenolol. SSRIs like sertraline might be replaced with bupropion, which actually has fewer sexual side effects. Different statins affect testosterone differently, so switching brands might help. Second, your doctor might suggest adjusting your dosage to find a level that effectively treats your condition while minimizing sexual dysfunction. Third, modifications can often reduce your medication needs. Regular exercise, maintaining a healthy weight, improving sleep quality, managing stress, limiting alcohol, eating a balanced diet rich in antioxidants and healthy fats, and quitting smoking all support better blood flow, hormone balance, and nerve health. These changes can sometimes allow your doctor to safely reduce your medication dose while maintaining the health benefits you need. Finally, in some cases, adding complementary treatments or therapies might help manage your condition while preserving sexual function. The key is working collaboratively with your healthcare provider to find a personalized solution that addresses both your medical needs and your quality of life. You deserve to be healthy and to have a satisfying sex life. These don't have to be mutually exclusive goals.